All right, so it is 5:04, so I think we can go ahead and get started. Hi, everyone. Welcome to our March workshop. Super excited to be here and super excited to have you all here. Before we get started, just want to introduce myself. My name is Brianna. I work very closely with the Mind Out Loud program and students, and we're, again, super happy to have you here for our March workshop. We have some super fun and really insightful conversations planned for today. So without further ado, I'll pass it off to Aubrey to introduce our workshop host.
Hi, everyone. Jackie Martinez serves as Vice President of Supportive Housing at Jamboree. With over 15 years of experience in social services, she leads the planning, implementation, and evaluation of supportive housing programs, ensuring high-quality, compliant services. She oversees a team, collaborates with community partners, and drives program development to optimize outcomes for those in need. Jackie plays a key role in advancing CalAIM initiatives, aligning services with state guidelines, and achieving client enrollment and reimbursement goals. As a leader in CalAIM for permanent supportive housing, she integrates and develops innovative services that promote health and housing stability.
All right. Thank you so much, Aubrey and Brianna. As you already know, my name is Jackie Martinez. I'm with Jamboree Housing. I've been with Jamboree now for a little bit over 5 years. I've had the pleasure of working within the housing realm specifically for over 10 years, overall in social services for over 15 years, like Aubrey mentioned. And so being able to speak to you today about housing challenges that we're seeing in our community, but the impact that it has on those within our community is something that's very near and dear to my heart. So I'm really looking forward to, sharing what I've learned along the way, along with some best practices and maybe some newer concepts for you all. Really, today is more of an introduction. So if there are things that you maybe that pique your interest or that you're interested in, definitely I encourage you all to do some additional research. But really today is just to introduce you to some of these concepts, what we're seeing here at Jamboree, and basically a path moving forward in hopes of addressing not only housing challenges, but if we're able to address housing challenges by hopefully opening up more access to housing, overall the impact that it has on an individual, not just on their mental health, but their overall well-being is huge. All right, so perfect. Thank you, Brianna. So about Jamboree, not sure how many of you are familiar with this organization, but Jamboree is a nonprofit affordable housing developer here in California. We are celebrating our 35th anniversary this year. So Jamboree has been in the business of building affordable housing, not only for those who've experienced homelessness in their time, but for veterans, for seniors, for low-income families, everyone in our community who's in need of affordable housing, Jamboree has done it. Affordable housing is important for so many reasons, right? Just like that term indicates, it's affordable, it's housing. But Jamboree also has a services arm within our organization. So we provide resident services and supportive services to our residents that reside within our communities. Because we recognize that affordable housing is not just an essential piece to someone's overall well-being and their ability to accomplish goals, but it's also very important to provide the services that they need to keep them housed. Right? So, life skills groups, workshops, case management services, access to benefits. That is what our team does on site to be able to support our residents' goal and maintaining and retaining their housing long term. So again, being able to speak to that experience, we've seen folks on that spectrum, and we've seen a lot of success in keeping individuals and families housed for a long period of time. So for Jamboree, our mission is to deliver high quality, affordable housing and services that transforms lives and strengthens communities. The pictures that are on this PowerPoint are actual pictures of our residents who've given consent for us to share this information, and their photos. Our vision is that every person will live in a strong and healthy, sustainable community. Because we realize by building affordable housing within our communities, we're able to contribute and then bring in individuals who maybe haven't been housed or haven't been housed in quite some time or had, quality housing. They can contribute to the community at large. And like I mentioned earlier, we serve families, seniors, special needs, households, veterans, formerly homeless, and then most recently, we've opened up projects that serve transitional aged youth, which are individuals from 18 to 25 years old. So we're really excited about some projects that we've opened up in Northern California, along with a new project that's expected to open at the end of this year in Southern California. All right, if you can go to the next slide, fantastic. And so again, just a quick snapshot of where Jamboree is at. We have over 100 properties throughout the state of California, which translates within those properties over 10,000 apartment homes. We serve over 25,000 residents. That includes adults, seniors, and children. We've received over 140 awards for the work that we've done, from architecture to services delivery to just the commitment and the collaboration within our communities. We have over 130 staff members. So what is unique about Jamboree is that we have different departments in-house. A lot of affordable housing developers contract out their services and bring them in-house, but everyone at Jamboree who's an employee of Jamboree is an actual employee of Jamboree. So that includes services, construction, business development, accounting, etc. And then our portfolio as a whole, the value of it is over $3 billion. So what I would like to start off by discussing, just to kind of help set the tone for this training and this conversation, is the concept of social determinants of health. So I know that there is a chat option. I'm just curious if any of you, and you can just say yes or no, are familiar with the concept of social determinants of health. And I'll pause for a minute to see if anybody is familiar with that. Oh, awesome. Awesome. Okay. Well, thank you for the folks that, responded to my question. Yeah, social determinants of health. It's a concept that is becoming more and more widely known. It's something that Jamboree absolutely looks to and is intentional about incorporating the concept of social determinants of health into the practices that we have in-house. That includes, the services that we deliver, how we construct housing, the type of housing that we build, and the population that we cater to. So just to briefly go over the social determinants of health, like it says here, the social determinants of health are the non-medical factors that affect health and well-being. Addressing these can lead to better health outcomes, right? And that includes mental health. And so that's why I wanted to bring this here and start our kick off this presentation is by briefly discussing this concept. On this PowerPoint, you can see to the side here is just a quick graphic on the social determinants of health. The main sort of bubbles around social determinants of health, those non-medical factors, are economic stability, neighborhood and built environment, health and healthcare, social and community context, and education, right? Really today, what I want to talk about, right, which is the main focus of today's presentation, is housing, right? There are housing challenges within our community. It is difficult to find affordable housing, let alone affordable housing that's quality housing, right? And so what the social determinants of health is saying within sort of that bucket of built environment is housing, period. Due to limited rental market and few affordable housing options, or even and not just built options, but just, being able to apply for an apartment or even a room rental that's vacant, it's limited. There aren't very many. And then if you're making, if your annual income is below 30%, it's even more challenging to find affordable housing. And like I said, not only affordable housing, but quality housing. I think a lot of times individuals that are facing housing challenges will sometimes settle for housing options that are not ideal, right? There may be maintenance issues, mold, water leaks, inadequate heating or cooling, or they may be forced to move in with other people, potentially resulting in overcrowding. And overcrowding essentially is when there's more than two people living in housing, depending on the size of the housing option. It can be a lot. If you're in a studio and you have 2 or 3 people in that studio, or if you're in a room rental and you have 2 or 3, 4 people in that room rental, that's overcrowding. There are some general occupancy rules that the states follow. Typically, it's 2 people per bedroom. So if you're in a 2-bedroom apartment, the maximum occupancy, ideally, that one would be allowed to stay in a unit like that would be 5 people, right? 2 bedrooms, 2 per bedroom, and then 1 person potentially in a living room and a pull-out couch. That would be the maximum. But if you're maybe considered low income or have limited access to housing options, you may exceed that. And that is actually very true for a lot of individuals within our community. And so not having access to housing or adequate housing impacts your health, right? Think about it. If you're someone who is experiencing homelessness, and I mean, homelessness in and of itself is a traumatic experience, right? Living on the streets, living in a shelter, being unhoused for a few months, even years, that has a huge impact on someone's overall well-being, especially their mental health. I often refer to it as someone feeling like they're in fight or flight mode. When you're constantly in that mode, it's difficult to relax. It's difficult to focus. Individuals in that situation tend to gravitate towards unhealthy coping skills like substance use, alcohol use. If you are experiencing health issues, both mental health and physical health, if you're homeless, how can you go connect with your doctor to access those services? It's much more difficult. Having housing and access to housing, being housed, gives one the opportunity to then address those issues that they're experiencing, right? In this case, we're talking about mental health. If someone has some sort of diagnosis, access to their medication is going to be that much more difficult. Access to their therapist, much more difficult. If somebody who we suspect has a mental health diagnosis, but is not connected to a medical provider, they can't even go forward with getting that diagnosis to begin with because it's not a priority to them, right? Living and surviving, that is the priority. So I just wanted to take a moment to highlight the social determinants of health and the reason it's so important. Housing, quality housing, and access to timely housing is very important. If we can go to the next slide, perfect. So like I briefly mentioned in the previous slide, being homeless is a traumatic experience in and of itself. So I just wanted to briefly explore that a little bit more and just talk about housing challenges in general. So there's sort of 2 buckets when it comes to housing challenges. And for me, for today's presentation, I'm really going to be referring to HUD's definition of homelessness and at risk of homelessness for today's session. So I'll start off with types of homelessness. I have sort of 5 different bullet points here that capture the main types of homelessness that one may experience in our community. One is chronic homelessness. So by HUD's definition, chronic homelessness is an individual or a household, could be a family, that experience homelessness at a minimum 12 months consecutively in 1 year, or within 3 years have had 3+ more episodes of homelessness. And those episodes of homelessness are documented. In addition to that, there is some sort of verifiable mental health diagnosis or disability, right? So that's chronic homelessness. Transitional homelessness is a type of homelessness where they may be transitioning from some sort of facility or jail. They're transitioning from that setting into homelessness, right? So someone who maybe has been in jail for a year, then they leave, they have no other housing options. That's sort of an example of transitional homelessness. Episodic situational homelessness is basically what the name itself indicates. It's an individual or a household who has come up against a situation that has caused their homelessness, right? They may not have had a history of it. It hasn't happened prior to their family, but an example of episodic or situational homelessness may be someone who's in a domestic violence situation, and that situation caused them to become homeless, right? They fled that housing situation and now they're homeless, seeking some sort of housing option, a shelter, etc. Hidden homelessness is often referred to as family homelessness. So a lot of families who have children in their household hide, right? They're not going to congregate in areas typically associated with what we think where homeless individuals would congregate, right? Big shelters, maybe frequent spots in a certain community, certain streets, bus stations. They're not going to congregate there for a variety of different reasons. One of the main reasons really is because they have minors in their household. They want to sort of shield their children from that experience that they're currently going through. So they may keep them in their car, go into a neighborhood, somewhere that's hidden, somewhere that's far away from the open streets. There's also this misconception with families that if you are experiencing homelessness, that a family could potentially lose their children because they're experiencing homelessness. I will tell you that is not the case. That is definitely a misconception. A family with minors in their household can be experiencing homelessness as long as the children's needs are still being met and there's no neglect. So the kids are still going to school, they still have access to food, water, they're able to bathe. So the act of homelessness itself does not equal children being taken away from their parents. And then, like I mentioned, it's family and youth homelessness. So like I mentioned before, transitional aged youth, that seems like those numbers are definitely growing within our community. For, again, youth leaving the foster system, youth maybe fitting those other buckets of episodic situational situations, transitional situations, or leaving a family who's maybe have experienced a history of homelessness themselves. So those are the sort of the main buckets of when it comes to types of homelessness. Now, at risk of homelessness, again, going by HUD's definition, I'll briefly go over that. Per HUD, Someone who's considered at risk of homelessness is somebody who will lose their housing within 14 days. Someone who has no housing identified given the situation, an individual or family that lacks resources or supports to access other types of permanent housing, a household who is below 30% of the median family income, is currently living in a home or other situation because of economic hardship, lives in a hotel or motel that's not paid for by an organization. So essentially they're living in a hotel paying out of pocket, exiting an institution, or living in a situation where we would consider it maybe doubled, tripled up. So those are different types of homelessness and at risks of homelessness. And I think on both sides of the spectrum, there's definitely an impact, right? If you're on your mental health, if you are actively experiencing homelessness, living on the street, sort of being in the fight or flight mode, it has an impact on your mental well-being, your physical well-being. And it's hard to be future focused, right? You're constantly present focused, surviving. How do we get our immediate needs met? And that stress takes a physical toll on an individual. I'll just quickly share a lot of projects that we would deem or categorize as permanent supportive housing. For those that are not familiar with it, it is a evidence-based type of housing where it comes with some sort of subsidy or voucher, project-based voucher, and essentially it's permanent housing. There's a lease sign. That individual only has to pay a portion of their rent because the city covers the remaining portion, but it comes with permanent case management services. And so those individuals that we serve under permanent supportive housing, we're serving folks. Really, the only way for you to be eligible for that type of housing option is if you have had a long history of homelessness, right? You meet the definition of chronic homelessness. So these are the most vulnerable individuals with the longest history of homelessness, and they get matched to a permanent supportive housing project. What we see, especially for individuals who are seniors, is once they become housed, it's sort of like, I have housing, I can finally relax, I can finally enjoy myself in my remaining years. What we're seeing is within a year or so, those individuals sort of pass. Anecdotally, what we're seeing is part of the reason is now that they're finally able to sort of relax, the impact, the physical impact related to that stress is finally comes to the surface, right? Maybe some of you know this or not, but that stress and anxiety manifests itself physically. It definitely impacts your physical health. So if you're not accessing regular medical services through a primary care doctor, your physical health can definitely worsen because of that. And so it is something at our projects that we monitor and keep a close eye on. But like I mentioned, it does have an impact on both mental and physical health. All right, if you could please move to the next slide. Thank you. Let's see here. So understanding mental health. So the next couple of slides, I referenced information from a nationally known organization. It is called the Corporation for Supportive Housing, CSH. If you guys are not familiar with that organization, I highly recommend that you look them up. I reference them here because, again, for Jamboree, as affordable housing developer, we build all types of affordable housing. Currently, our focus is permanent supportive housing, which I referenced earlier. And CSH basically provides a lot of guidance and structure around all things PSH. Best practices on service delivery, how to build a meaningful mindful PSH project, how to build a tenant council and incorporate individuals with lived experience and gaining their feedback and incorporating it into the services. And so a great resource, and definitely an organization that we reach out to regularly for support and guidance when comes to our PSH projects. So just to briefly talk about understanding mental health, here's just a quick snapshot on some mental health basics. Mental illness or mental health disorder essentially is categorized as a diagnosable illness that affects a person's thinking, emotional state, and behavior. And it disrupts the person's ability to work, carry out daily activities, and engage in satisfying relationships. For example, live, love, laugh, and learn. I also mentioned here a substance use disorder. It is, we work with a lot of individuals who experience co-occurring disorders, which is essentially this. They have both a mental health diagnosis or disorder and or also have a substance use disorder. So those are definitely individuals that we work with within our PSH projects. And again, going back to individuals are most vulnerable in our community. You know, if someone has experienced a mental health diagnosis or has a mental health disorder, many times ways that they cope with that disorder is through substance use or alcohol use. So, you know, it's important to know that those things can exist together. And it's also important to recognize that these individuals need patience, time, care, and encouragement towards accessing those services. And it's something at our permanent supportive housing projects that we actively focus on and try to incorporate wraparound services to those individuals. And then lastly, just to touch on the concept of recovery, it's a person's journey with the goals of hope, empowerment, and autonomy. So being able to understand these things and understand mental health allows us the ability to provide comprehensive, meaningful services to the individuals that we serve. As you can imagine, being homeless and then becoming housed, it's a transition. If you've experienced homelessness for 5+ years, you haven't held a lease, you haven't, you know, rented anything in quite some time, whether it's a room rental, an apartment, etc., it comes with its challenges, right? You not only have to learn how to be a good tenant, but you also have to learn to be a good neighbor. And sometimes those things can be very challenging when you're dealing with mental health issues, especially if it hasn't been something you have been accessing actively during your time of homelessness. So we have a team on site who are trained and equipped to handle these types of situations. And we definitely see the importance of it. And really, at the end of the day, by working in this field, we have to be trained. We have to understand and know the best way to support these individuals so they can succeed in the long term. Go to the next slide, please. All right. So I wanted to take a moment to talk about trauma, because it definitely plays a role in just understanding mental health, understanding homelessness, like I previously mentioned. So again, I'll just ask the group really quickly, are any of you familiar with the term trauma-informed care? Okay. Awesome. Well, thanks all. So trauma-informed care is essentially the training, awareness, and incorporating those trainings and awareness into practices that understand the impact of trauma, and on an individual, essentially, right? It's, for example, and with regards to this training, you have an individual or a household who has experienced homelessness, like I mentioned before, that is a traumatic event in and of itself. And so someone who is either actively homeless, experiencing at risk of homelessness, or transitioning into housing, that trauma, whether it's related to housing or just traumas in their past, may come out in certain behaviors and certain reactions, right? A lot of times what we see on site and working with individuals in these situations is maybe we're sitting with them and going over their case management plan, and we bring up paying their rent on time, right? And unfortunately, that causes a sort of reactive response from them where the case manager on the other end may perceive it as a lashing out, right? But having an understanding of trauma-informed care, it allows our team to take a step back and recognize, well, this is not about me, right? This is a reaction probably related to the trauma that they've experienced being homeless. Now they're housed. Maybe he's just reacting and yelling at me because he doesn't feel prepared to pay his rent, or he's feeling overwhelming about paying his rent. So let me pause. Let's take a step back, try to have a productive conversation or revisit this conversation. But it's being able to not take that personally in that moment and recognize that this is much deeper than them getting upset about rent. This is probably associated with the trauma that they've experienced in their past, and transitioning into homelessness is impacting that even more. So just quickly referring back to the presentation, understanding trauma and some common signs related to it. You may notice that someone is withdrawing. There's mood changes within that individual that aren't typically normal of them. Maybe possibly increased substance use, problems thinking or focusing, unexplained physical ailments or complaints. There was once an individual that I worked with where she constantly complained of back aches and stomach aches. And no matter how often she went to the doctor said, no, you're fine. There's nothing wrong. It was very real for her as a person. And it ultimately, through the care that she received through her therapist, she was able to connect the fact that this was associated with the stress and anxiety she was experiencing at the time because of some situations that were occurring around her. And then just decrease in overall functioning, especially if it's an individual that you know or a family that you know, and you notice that changes, you're like, they're just not as alert. They're not just as aware of as they typically are. It's just, those are just signs to be aware of, because this could be observed in anyone. Again, like I mentioned, understanding trauma. Trauma defined by CSH is an emotional response to a terrible event, a traumatic event, a deeply distressing or disturbing experience. And this is subjective. Depending on who you are, the definition of a traumatic event will vary, right? What I define as a traumatic event will be different from you, from me. So it's really just being able to be open and mindful, knowing that it is very subjective. Types of trauma. There's an acute trauma that results from a single incident. There's chronic trauma that's repeated, prolonged, such as domestic violence or abuse, or someone who's experienced chronic homelessness, like I mentioned, or maybe various episodes throughout their childhood or lifetime around being at risk of homelessness. And then complex trauma is exposure to varied and multiple traumatic events, often of an invasive and interpersonal issue or nature. All right, if you can go to the next slide, perfect. So what I thought would be great to share with you all, just to provide some additional data and metrics around the impact, the positive impact around housing, I wanted to share with you all an evaluation or some information on an evaluation that Jamboree conducted in 2022. So Jamboree, we work with an evaluator who has done multiple evaluations for Jamboree Housing, an economic study, a study on families and children, education. And so we conducted a study on permanent supportive housing. Again, this was done in 2022. And so this project is called Buena Esperanza. It's located here in Orange County, California. This project is in the city of Anaheim, and it was a motel conversion. So for those that don't know what a motel conversion is, it's basically, it was an old rundown motel with 70 rooms that Jamboree acquired and then changed and built into permanent supportive housing. So those rooms became studios, and we were able to house 69 chronically homeless individuals within our community. And one of the apartments, which makes up the 70, was for the property manager on site. And as you can see, it's a beautiful, you would have never imagined it looked like an old rundown motel. It really came out beautifully. If you could go to the next slide, please. I think I'm close to time. So permanent supportive housing, it changes lives. Prior to living at Buena Esperanza, again, of the 69 households, 39% of those individuals were living in an emergency shelter. 32% were living on the street, and 10% were living in a motel where an organization of some kind, nonprofit organization, was paying for the motel stay. So some basic demographics, again, there's 69 residents. Interestingly enough, majority of the property, the individuals that were housed were 70% male. Age range was from 23 to 80 years old, but the average age was 55 years old for this project. So earlier in my presentation, I mentioned to you anecdotally, we had older adults who would transition into housing, and then within a year, many of them did end up passing away. I was referencing this project as that example. And in that picture, that is Buena Esperanza, and that's the courtyard there at Buena Esperanza. That's where the pool used to be. We covered it up, and then we added a community garden for our residents to not only plant items, but it also promotes social engagement and a sense of community within the property. If you could go to the next slide, please. So PSH, again, a type of housing that is made available and that Jamboree focuses on. It fosters self-sufficiency, promotes better health outcomes, and is cost-effective. So out here in California, there was a cost study done around homelessness and the impact of homelessness. And essentially, the outcome of the result of that report was building more affordable housing or having access to housing is a lot cheaper, essentially, when it comes to serving vulnerable individuals in our community, right? As opposed to homeless individuals or vulnerable individuals in our community constantly accessing emergency response services that has a higher cost over time. But having someone housed where they can stabilize and focus on their both mental and physical health, it's a cost savings for the community. So ultimately, it's worth funding and building more affordable housing. So just some pieces here to highlight, again, related to mental health. Permanent supportive housing, again, Buena Esperanza as an example. 80% of our residents reported being able to better control their lives and have a better sense of control since moving in. 90% indicated they were able to deal more effectively with daily problems after being housed. It improves residents' hope for the future. 94% of our residents reported their outlook on life improved since moving into housing. 83% indicated they felt better about their future since becoming a resident. 97% of our residents reported that on-site supportive services were beneficial to them. Again, in the purple square, it specifically talks about mental health. 83% of our residents reported both their mental health had improved and that their feelings of happiness had improved since moving in. And then we had 95% of residents reported that they're making progress towards their recovery since becoming housed. Living in PSH reduces residents' stress levels. 84% of our residents reported that stress had improved since moving in. 50% of our residents reported that their physical health had also improved since moving into permanent housing. All right, if you can move to the next slide, please. Oh, perfect. Thank you. And then here are just to be mindful on time, just some additional metrics and data around what we discussed. Supportive housing with services has proven to permanently keep our residents, majority of our residents in this type of housing from becoming homeless again. We have a success rate of 90% of our residents staying housed for over a year after moving into one of our projects. All right. And that's it. I just wanted to thank you for your guys' time. It's been a pleasure. I hope that you found this training beneficial. If not, just more informative, where you've gained some additional insight into new concepts and understanding the impact of housing challenges, mental health, and the benefits of permanent supportive housing. Thank you.
This was really so much. Jackie. Are you catching the feedback, or is it just me on my end?
I'm not. On my end, I'm okay.
Okay, great. Just making sure. Thanks. So if any students have any questions, feel free to put them in the Q&A function as per usual. I'm sure Jackie would be happy to answer any questions that she has. And yeah, thank you so much for this. I really appreciate it.
Of course. Thank you all for having me.
Of course. Don't be shy.
Oh, here we go. Okay, we have a one question that did come in. I know it was mentioned that older residents passed away due to their stress manifesting as physical illnesses. Do you think they would have passed away earlier in homelessness? I think, again, referencing that study that was done on the cost of homelessness, that definitely was referenced within that study, that lifespan of somebody who's experienced homelessness, specifically chronic homelessness, does impact obviously their overall health and well-being, and then obviously being able to access medical services in a timely manner. So by default, one could say that it could lead to a sooner passing or death of an individual on the streets. again, someone who's more chronically homeless. Most recently in one of our projects, we had somebody who had experienced cancer and was homeless for close to 10 years. And so, again, having gone through that experience, not having access to medical services, in addition to that stress and that manifesting physically, that combination could have left to that, or could have led that person to passing away a lot sooner, as opposed to them being housed when they were. Let's see. That's a good question. So, what stigmas do unhoused individuals face from both the public and providers? I think that's a really good question. There's definitely a stigma attached to someone who is identified as homeless or unhoused. Um, I think the most common misconception, especially in this field of work that I'm in, is that um, their decisions led to them, their poor decisions led to them being homeless, right? Which is not always the case. Or another big stigma or misconception is, if we're providing services, we only want to provide services to those within our county or within our city, within our region. And not recognizing that a lot of the individuals or families that are homeless actually have current active ties to the city that they're in, right? It isn't necessary that they're floating from one state to the other. And not to say that that doesn't happen, but there's definitely a stigma with, well, if you're not from this area, we don't want to serve you, right? Or, you don't want to work, your substance use led to you being homeless, right? You don't have the active life skills to get you to that next place. If you really wanted to be housed, you would be housed. Being in the field that I am, I know it's not that simple, right? There are individuals and households where, yes, maybe there is substance use or mental health issues in their history. But again, understanding trauma and trauma-informed care, I can recognize it's much deeper than that, and giving them access to housing and services is going to give them the ability to address those goals, and ultimately be self-sufficient. That's the ultimate goal. So I think we see that definitely from the public, and I would say from providers, or I would say service providers. This is not an easy industry to be in. It can be very challenging to work with individuals that have experienced homelessness. So individuals in this field can maybe at times feel a little jaded, burnt out, and so maybe not being as patient or considerate, and maybe also falling into that narrative that individuals don't want to achieve certain goals. It can be difficult to navigate, but that's why it's important to first, for one, to focus on self-care and really examine, is this really the field for me? Because at the end of the day, the people that we're serving, we want to make sure that we're providing them quality care, which means that as an individual serving them, we have to be in the place and the space to do our job well and be open-minded. All right. I hope that was helpful. I know that was like my long, sort of winded response to your question.
Thanks for that. At least, like one question that I had, and I think you spoke to a little bit during the presentation.
Sure.
Do you think it would be accurate to say that like having stable housing is as important as your physical health?
Absolutely. I guess I'll go back to referencing the social determinants of health, right? Both your mental and physical health is directly impacted, I think, by the type of housing that you have. So if you have permanent, stable, quality housing, you may have a mental health issue or a medical diagnosis or actively, you know, using substances. But, you know, again, how are you supposed to access care, get that primary care doctor, get your insurance, even find a job, focus on transportation if you're just constantly focusing on surviving? Being housed allows one to be able to step back and focus, but not just focus, but focus on their future. I think housing absolutely allows someone to do that, which in turn, you know, allows them to improve upon their physical and mental health.
Thanks for that.
Of course.
All right. If there are no other questions, just want to thank you all so much for attending our March workshop. Stay tuned for our April workshop. We have that cooking up right now. And a special big thanks and shout out to Jackie for hosting our workshop and being able to talk a little bit more about mental health and its intersection with housing.